Hi, today I'm going to do the urinary catheterization. The first thing that I need to do, I have to check the physician's order for catheterization. Then do the hand hygiene, go to the patient's room, introduce myself, and do the procedure. Okay. I check the physician's order. Hi, Mr. Jones. How are you today? My name is Fatima. I'm your nurse. I'm going to do the catheterization for you. Can I have your full name and date of birth, please? Okay, thank you. Can I see your armband, please? Perfect, thank you. For your privacy, I will close all the curtains. Okay? Okay, thank you. Do you have any kind of allergy? Allergy to latex, for example? No? Perfect. Do you have any pain? No. Okay, when was the last time that you voided? Okay, perfect. Is that okay if I touch your tummy to see if there is any retention? Okay, and then I will palpate around the tummy to see if there is any pain, any retention, or any abnormal finding. If I'm going in the real situation, I will clean all the table. I make the space for all my stuff so I can reach to them easily. Then I will put the table in my waist level to be accessible to everything, and put the bed rails down to make a good working level. So we consider that we all did all the stuff. Okay, if the patients, I will just let you know. If the patient is female, we need to position the patient in a dorsal recumbent position with hips externally rotated. But if the client is male, we need to position him in dorsal recumbent position with the legs spread apart. For privacy and comfortability of the patient, we need to cover the patient and expose only the perineal area. Okay. Now let's start. You consider this is a betadine. I need to put the betadine into the cup with syrup. I open it. I put the betadine. For non-dominant hand, I put my finger behind the gloves and then put on the gloves. I know that when I put on my gloves, I have not to touch anything else in order to not contaminate my gloves. This is the sterile field. There is a shiny part and matte part. We need to put the shiny part against the patients. So, in order to not contaminate my gloves, I have to hold the sterile field like this, folded like this, and put it between the legs of the patient. So now, because I'm going to make a good space for working, I try to move a little bit the my sterile bag, but in real world I know that I don't have to touch anything. Okay, now I fold it and I will put it into between the patient's leg. I will try to adjust the patient's, and I know I will put this so you can see the patient, but I know that I have not to touch anything else. Then I will put the fenestrated sterile field over the patients. I will hold it and fold it like this, so not contaminated, in order to my gloves not contaminated, and then put it over the patient's perineum area. I have to make sure this fenestrated sterile field not contaminated with the perineal area. If the patient is female, we just expose the labia area. If the patient is male, we need to expose it. We need to put it over the thighs of the patient and just expose the penis. Now I will open the lubricant and lubricate the catheter. The tip of the catheter, I will lubricate it and then put it into the sterile field. We don't need this for this video. I will prepare everything, then I transfer the tray between the legs of the patient. So now I will come here to show you. For the patient, you can see, move it a little bit. So, for the patient, for woman patient, I have to retract with my non-dominant hand. I will retract the labia And with my dominant hand, I have to clean it with swab. One side at each time, clean one side from top to bottom, and then put it in the garbage. Again, the next one, clean and put it in the garbage. The third one, from center, from top to the bottom, clean and then put it into the garbage. If the patient is male, we need to keep and grasp the penis perpendicular to the body and clean with each swab. I need to clean just one circle at a time, and 3 times. I need to repeat it 3 times. Just clean one circle, put it away with another sweep, a little lower, clean another circle and put it away, and with another sweep, a little lower, clean a circle and put it away. This is for male. Then I just show you how to do with male and female. But when I clean the labia for women, I need to insert the catheter that before I have already lubricated. I will retract the labia to appear the urethral meatus clearly. So I have to insert the catheter into urethral meatus. I try to go in, because it's female, I keep going until 5 to 7 centimeter, or until the urine flows from the catheter. When the urine appears, we advance inserting the catheter 2.5 to 5 centimeter more to make sure everything, the catheter is in bladder and everything is good. And now we release the labia with our non-dominant hands. We make sure, first we have to make sure that the catheter put into the basin. So we keep it until the bladder is empty. When the bladder is empty and all urine is empty, I will gently release the catheter and put it into the garbage. Okay. Then we need to make sure that we have to check how much urine is empty, because we need to document all our finding. We put the urine in the measuring cup, so in order to be able to measure the amount of urine, and then we document into the patient chart. Then I need to dispose all the stuff and put it into the garbage. I will document this. After I dispose all the stuff, I will clean my, I will remove my gloves. Do hand hygiene. I will cover the clients with the blanket. I will ask patient if she's okay. she's in comfortable situation, I will put the bed rails up and put the bed in the previous position. Miss Jones, is everything okay with you? Are you comfortable now? Okay, do you need anything? No, thank you, perfect. Now I will do the hand hygiene again, and I will document everything, every findings and everything that I did now. Thank you.